Welcome to Global Economic Press, where we deliver trusted global finance and economic news, analysis, and reports, empowering leaders and investors with reliable, timely insights. I'm your host, Alex Brady. In today's episode, we delve into the critical issue of medical malpractice and negligence, focusing on a recent announcement from a prominent New York law firm. Silberstein Miklos, PC, known for their expertise in personal injury law, has expanded their focus on medical malpractice cases in Brooklyn. We'll explore the implications of this expansion and what it means for patients and families affected by medical negligence. Silberstein Miklos, PC, ASK4SAM, a New York personal injury law firm representing individuals affected by medical negligence, today announced an expanded focus on Brooklyn medical malpractice cases involving surgical errors, misdiagnosis, and other forms of medical negligence. These cases may involve delayed diagnosis, medication mistakes, anesthesia complications, and failures to provide appropriate treatment that can result in serious injury, disability, worsening medical conditions, or wrongful death. The firm provides legal representation to patients and families throughout Brooklyn and the surrounding New York City area, with a focus on thorough investigation and accountability. Medical malpractice cases can arise when physicians, surgeons, nurses, hospitals, clinics, and other healthcare providers fail to meet the applicable standard of care. Surgical malpractice may involve wrong-site surgery, retained surgical instruments, preventable infections, negligent post-operative monitoring, anesthesia errors, or improper surgical technique. Diagnostic negligence may involve missed symptoms, incorrect interpretation of test results, failure to order appropriate screening tests, or delays in referring patients to specialists. Such medical errors can allow serious conditions to progress and may create extensive medical, financial, and emotional consequences. Patients who suspect that a surgical error, misdiagnosis, or other form of medical negligence contributed to an injury are encouraged to seek prompt legal evaluation. Timely legal action can help preserve medical records, secure expert medical review, identify potentially responsible healthcare providers, and protect legal rights under New York law. For information regarding potential medical malpractice claims, contact Silberstein Miklos, PC, at 718-204-8000 or visit ASK4SAM.net to schedule a consultation and learn about available legal options. Surgical error cases require detailed examination of the events occurring before, during, and after a medical procedure. Attorneys may review operative reports, anesthesia records, nursing notes, informed consent documents, diagnostic imaging, medication records, and post-operative documentation. Qualified medical experts can evaluate whether the surgical team followed accepted medical practices and whether a departure from the standard of care caused or contributed to patient harm. This evidence-based process can help establish negligence and causation in complex medical malpractice litigation. Misdiagnosis and delayed diagnosis claims can involve serious conditions such as cancer, stroke, heart disease, infections, sepsis, neurological disorders, and internal injuries. A healthcare provider may fail to recognize warning signs, order appropriate diagnostic testing, interpret imaging correctly, or respond appropriately to abnormal laboratory results. A delay in diagnosis can permit a disease or medical condition to progress, potentially reducing treatment options and increasing the severity of the resulting injury. Comprehensive review of medical charts, test results, diagnostic imaging, and treatment timelines can help determine whether a preventable diagnostic error occurred. Medication errors represent another significant category of medical negligence. Prescription mistakes, incorrect dosages, pharmacy errors, failure to identify drug interactions, and inadequate monitoring of medication side effects can expose patients to serious health risks. Similarly, anesthesia malpractice can result in oxygen deprivation, neurological damage, respiratory complications, or other life-threatening conditions. Investigating these cases requires careful review of medication administration records, anesthesia documentation, physician orders, and hospital procedures. Patients harmed by medical malpractice often experience substantial financial losses in addition to physical injuries. Medical bills may include emergency treatment, hospitalization, corrective surgery, rehabilitation, physical therapy, prescription medication, specialist consultations, and long-term healthcare services. Serious injuries can also result in lost wages, diminished earning capacity, disability, pain and suffering, emotional distress, and reduced quality of life. Medical malpractice claims may seek compensation for applicable economic and non-economic damages resulting from negligent medical treatment. Healthcare institutions and medical professionals frequently have insurance carriers and defense counsel involved in malpractice disputes. Insurance companies may challenge liability, causation, or the severity of an injury while attempting to reduce the value of a claim. Silberstein and Miklos PC approaches these cases through comprehensive documentation, expert analysis, and strategic negotiation or litigation. Medical records, expert testimony, treatment histories, and other evidence can provide essential support for claims involving negligent healthcare treatment. Hospital negligence can also involve broader institutional failures. Inadequate staffing, poor communication, insufficient supervision, failure to follow patient safety procedures, and defective or improperly maintained medical equipment may contribute to preventable injuries. Identifying systemic failures can be important when determining whether responsibility extends beyond an individual physician or healthcare professional. Thorough investigation helps establish the full circumstances surrounding a patient's injury. Medical malpractice litigation also serves an important patient safety function by promoting accountability within healthcare institutions and encouraging adherence to established standards. Legal claims involving surgical errors, diagnostic failures, medication mistakes, and hospital negligence can bring attention to practices that may place patients at unnecessary risk. Accountability can support improved procedures, documentation, communication, and safety measures throughout healthcare facilities. Serving Brooklyn and surrounding New York City communities, Silberstein and Miklos PC represents patients and families facing the consequences of medical negligence. The firm handles complex claims involving surgical malpractice, misdiagnosis, delayed diagnosis, medication errors, anesthesia negligence, hospital malpractice, emergency room negligence, birth injuries, and wrongful death. Through detailed investigation, collaboration with qualified medical experts, and strategic legal advocacy, Silberstein and Miklos PC works to pursue accountability and fair compensation for individuals harmed by preventable medical errors. For additional information regarding medical malpractice representation, contact Silberstein and Miklos PC at 718-204-8000 or visit https://ASK4SAM.net. About Silberstein and Miklos PC. Silberstein and Miklos PC is a New York personal injury law firm representing victims of negligence throughout Brooklyn, Manhattan, Queens, the Bronx, Staten Island, and Long Island. The firm handles medical malpractice, surgical errors, diagnostic negligence, hospital negligence, motor vehicle accidents, construction accidents, and wrongful death matters. Through comprehensive case preparation and dedicated legal advocacy, Silberstein and Miklos PC works to protect the rights of injured individuals and pursue appropriate compensation under New York law.